I'm very honored today. To be honest with you, it's something else. I have to be describe to you how emotional will be this interview because as a person who is part of my childhood, I'm talking about a teammate, a swimming teammate, a schoolmate, a person who share the same school bus to going to school back and forth, who cheer for the same soccer team. So, and the person who developed a great work today has a special achievements and we will learn a lot for some area we didn't discuss here yet. I would like to introduce to you guys Dr. Mario Francisco Pereira Juruena. He's a clinical senior lecturer at translational psychiatrist at King's College of London. Very honored to have you here today.
Thank you very much, Pussy. May I call you Alex Pucialdi, but of course, since you know for a long time, it's my pleasure to be with you here. I'd like to just thank you and thank Eloisa for inviting me for this honor possibility to share my experience with you.
You see a person to develop such a kind of achievements in a professional way. Please tell us, what about the journey to becoming a global person? At school, you start in Porto Alegre, São Paulo, London, USA, the world.
Yeah, I think the first time that I decided to go abroad was when I was a teenager and we were studying the same school and swimming at União in the same team. I did an exchange to Florida. I spent some time in St. Petersburg, near Tampa Bay. And this was amazing time that I could have the possibility to learn more about American way of life and compare with our South American way. And definitely this is helped me to open my mind to different points of view, you know. And I left the swimming very earlier, you know, because I need to prepare for the medicine course. And I remember when I received the good news from you that I was accepted and selected to start my undergraduate course in medicine. And so since that time, I decided to possibly go for teaching, you know. And so during my my early career, even as a medical student, I think that was really important to share my experience with younger students. And then I started to do some what you call monitor. It's like an older student that tried to help younger student in physiology. I like human physiology was the basic science that I study more. And then I decided to become a psychiatrist very earlier. I was around 20 years old, 21. And this has opened me several opportunities to travel to São Paulo and to attend some meetings, some conferences. And then I moved to São Paulo. And then I did my training in Federal University of São Paulo, Unifesp. I did a master's in psychobiology of affective disorders in São Paulo. And then I really enjoyed that time because it was a federal university that can provide you possibility. We have a swimming pool there, Pussy, that I usually swim at that time almost 3 or 4 times per week. And I took part in the first master of my career. And I was quite young, around 26, 27 years old at that time. And then I think this is important to say that being a swimmer for, let's say, 10 or 15 years, give me the possibility to look for difficult targets and try to reach them. And I think this is really important because if you do some sports when you are young, it helps you to increase your resilience and try to achieve your points. You know. When I finished my master's, I come back to Porto Alegre, my hometown from São Paulo, and then they invite me to become assistant professor in the Federal University of Porto Alegre, that is close to Santa Casa. And I was already at that time preparing new generation of psychiatrists, residents, and other young doctors. And so this has opened the possibility to start a PhD at the University of Rio Grande do Sul, the main university in the clinical hospital. But my supervisor at that time reached the Professor Alex. He became the dean of the University of Rio Grande do Sul. And then he said to me, Mario, I think you already did a very important master's in São Paulo. I think there's nothing that you can possibly reach here in Rio Grande do Sul. If I was you, I can support you to go abroad. And I think the best place for you to study the area that you are interested in, that is depression. And HPX is another area that I'm studying that is related to stressful situations. You know, if you are suffering from any kind of stressful situation, childhood trauma, or even recent stress events, it impacts in these hormones that are related to the stress axis. And then Prof. Alex said to me, why don't move to London? There is some good connections there, and I will support you from the CAPES and CNPq to do a PhD there. And then I applied. I got the scholarship, and I moved to London, and I work not 4 but almost 6 years in the Institute of Psychiatry at the King's College London. At that time, it was really impressive because we arrived here, my wife and I, in 2002, without a child, and we decided to have our first child here. And so it was a difficult challenge because I was finishing another master's. I decided to do a second master's in the Netherlands. And so I usually travel, Pussy and Eloisa, to Maastricht and to the Netherlands to start this master's that was in affective neuroscience. And at the same time, I was starting my PhD here at the King's College London, and also validate my certificate as a medical doctor, as a psychiatrist here in UK. And my wife was pregnant. So this is, you can imagine how many things I'm doing here, just starting this time. But everything runs smoothly and well. I have very good supervisors. One of the things that maybe I can say here now is that when I moved here, they offer me very senior professors to be my supervisor in my PhD. But I connected with 2 guys that are on the same age that I had at that time, around 30 something. At that time, they are not professors, full professors. They are senior lecturers. And one is a British guy, Professor Tony Clear. He's a good friend of mine. He has a son with the same age of my son, 16 years old. And the other is an Italian guy that did his training in US, in Atlanta, Georgia. And he's an expert in several approaches for biological psychiatry. And I decided that I would like to be supervised by these young guys. And they are in the top, you know. They are not so experienced in teaching, but they have a lot of experience in clinical research, and they are publishing a lot in very impacted journals, high impacted journals, and so they are my friends until now, you know. And then when I moved back to Brazil, because I received a scholarship from the Brazilian government. So the Brazilian government paid me for stay here in UK for 4 years. And then I got another grant from the American foundation, NARSA. This is the most important foundation in the world for mental health. And they support me for a postdoc here for more 2 years. And then I negotiate to stay 2 years more here with the education ministry in Brazil. But then they said, oh, you need to apply for a university. And then I received an invitation to enter in a contest for a post as an associate professor in the University of São Paulo. And I applied and I got the post. It was good. I spent there, I think, almost 5-6 years in the University of São Paulo. I improved my skills in teaching research. I supervised 6 PhD students in the University of São Paulo and 12 master students there. And I started a new service that I already mentioned. So I think it was a very good time to try to uh, share my experience in UK with my Brazilian colleagues, you know, try to settle a new generation of researchers and professionals. But in this meantime, I received proposals to stay here in UK, you know, and so they offered me a position as a visiting professor. So I come every year to UK to give lectures and to apply for research grants, and then I keep the links, you know, visiting professor in UK and associate professor. They call me professor doctor in University of São Paulo. And this was a good time that I spent there and tried to connect it Brazilian researchers and British researchers. I invited Tony, my mentor, my PhD supervisor. He went to São Paulo, gave several lectures there, and then I was invited because we have some groups in Brazil that are spreading mental health and psychiatry across the globe. And we organize Brazilian psychiatrists, Brazilian psychiatrists, neurologists, organize a nice important meeting in Montreal, Canada. So this was a meeting in Canada, in Montreal, organized by Brazilian researchers. They call brain and emotions. So this was really good because we integrate our expertise and knowledge with Canadians and Americans mainly, but also Europeans. And then in 2015, as associate professor in São Paulo, professor doctor, I got a good grant from the Royal Society and Academy of Medical Science in UK to spend 2 years here in UK. And then we moved to UK in 2015, beginning 2016, to stay here 2 years. But in the end, my director here, that he's the dean of the Institute of Psychiatry, said to me, Mario, we would like to have you longer here. I cannot offer you a permanent position now, but we'll have a contest for senior lecture here. You have a good CV if you like to apply. And so I got the position in the end of 2017. And then I need to move to UK to stay here.
You know, it's amazing. It's because it's identify one thing very clear: your passion to teach. That's very clear. And we have a scale on education what indicates us the several levels of learning. And one of the top of the levels to learning is to teach. I would like to know what you have been learning, even about yourself, your work, because when you teach, as I said, that's the best way to learn.
No, that's true. Do you remember when I was your colleague at secondary school? I don't like too much to study, you know. I study a little bit, but not too much, you know.
Enough.
Yeah, just enough, you know. I like to cut and paste and things like that, you know. So my point is, I decided that my father is a medical doctor. He's a plastic surgeon. So I think I like to do plastic surgery, but it's not really a passion for me. And so I decided when I was quite young, because I graduated in medicine when I was 22, I said, oh, if I would like to prefer to study instead of like our good friend Banya spend his time in Garopaba surfing. I just have a news that he's still there, afraid of the COVID time. He's in the mountain in his house, just surfing. And Magrão Stockler just mentioned this to me in a WhatsApp. So if I decided to go deeply in my career, I should do something that I really enjoy. And so when I was a medical student, I see that psychiatry is so amazing. You see, to understand people are so different cultures, different backgrounds, different vulnerability to develop any kind of illness. And this kind of vulnerability could be changed if you possibly apply different treatments related to mental health. And then I think this was something that impacted me and put me in the decision. But you are completely right. I think if you choose your career related to something that you really enjoy, and you like to share this experience with others, you learn much more, you know. And I think in this time that I'm trying to prepare lectures and prepare talks, I'm learning more about the topics. And when you have some good students, because here at the King's College is amazing, at University of São Paulo as well, but here I think is much more global. You see, on the top of my head, you have a globe. This is not for this interview. Is always there, you know. And so the point is, I think you have the possibility to, as I said, to supervise Chinese students, Indian students, people from Middle East, from Europe, from UK, from US, Canada, Brazilians. And so I think this is amazing to learn more about each culture and about each personality. And these guys have bright minds, you know. I think is a privilege to be in this position to learn with them and to prepare papers, dissertations, PhD theses with these guys, because I'm always reading, you know, as a lecturer at the King's College and as a consultant. I spend nowadays, in the last year at least, I spend 3 days per week at home giving lectures online. Now it's open here. Now our lectures will start to become face-to-face soon at the King's College. And I spend the other 2 days at the hospital seeing very severe patients and supervising also medical doctors in the early career. So I'm always learning in these different positions, and this is the amazing part of my life, because you can stay without learning, just doing your job, but if you don't have the passion to do it, it's difficult to open mind and to learn more about yourself, as you said.
Like, we are facing a difficult times this year with pandemic, over a year already. But you mentioned several disorders like depression, anxiety, bipolar, borderline disease, and all kind of things. My question to you is, this has been increasing or always has been there and we are not aware of that? Because the statistics, the control, it's much higher today. But my point is, like, this, we have the new generation are facing more challenges, or we are not aware this happened in the past?
This is a good question, Pussy, because, you know, I think both things are right. You know, I think in the past, you know, mental health usually are the poor sister of medicine. You know, usually not give a lot of attention to mental health. You know, depression is the most burdensome of all medical disorders that have the highest vulnerability to the increase difficulties to work, to share experience, to live in a nice life, or even is the high cost for any society in the world. Even in Brazil, that you think that Brazil is a happy country, but you know there is a lot of depression in Brazil. You know, between middle income countries, Brazil will have the highest level of depressive episodes, and so this is true. But also in this last year, if you think about isolation, that is important to prevent for COVID. If you think about people are living in the same place, children are not going to school, domestic violence can increase in this situation. Abuse of alcohol and drugs can increase in this situation. Elderly people do not have contact with friends, family members. This can increase also. The suicide attempts increase across the globe as well, even in children and elderly people. Possibly with the economic situation as well, this is impacting mental health. If you have a work, if you have money, you have a salary, this is possibly helps you to keep going. But if you lose these, it will impact in your mental health definitely. So I really believe that there's evidence for this, that in this time mental health is what we call the third wave of this COVID time. You know, this is sometimes good because several governments are putting attention in mental health at the moment, and you have several opportunities for doing new studies and research grants related to COVID. Most of the foundations and charities are offering in UK, in US, Canada, Australia, and the main countries that are providing research fundings for or grants for research. They ask it to associate how mental health are impacting by COVID. But I think you're right. Both situations are happens, and you hope that you can overcome these times.
It's like definitely we have a little lack of knowledge, the regular population, about depression and how identify depression, anxiety, and all the things. And can you please describe to us in a small, you can bring a little brief, what's the real difference in between depression, anxiety, other disorders, and how a regular family person could deal with that? Because, as you said, and you mentioned before, it's like sometimes we don't have all the regular service available to us, and especially a country like Brazil, and how we can approach a problem like that.
Yeah, so this is a course, Pussy, but I can try to summarize these in brief words. The point is, if you think about, let's say, start with depression, that I said that is the most burdensome of all medical disorders, including cardiovascular problems, oncology, neurological problems. When you have a person that usually have an impact in their life, the quality of life, social impact, economical impact, emotional impact, and the main symptoms possibly could be loss of interest of things that you really enjoy to do. So you really enjoy to write about swimming. So you really enjoy to interview people related to Olympic sports. If suddenly you disappear, what happens? You are not writing anymore about these champions. You're not interviewing any other swimmer that is really impacting the Brazilian swimming or overseas. Then you say, oh, something's happened. He lost the interest. But this is not enough. You should also have a sadness. So are you call you in the WhatsApp and say, Pussy, what's happened with you? Are you depressed? And then you look at me with sad eyes, and you said to me, yes, I'm crying every day. I'm really losing my interest in the things that I enjoy most. I cannot see the interviews in the Globe person that I really enjoy, to see Heloísa interviewing Linai, Mauro Negrão Freitas Vale, and Bia Brazil, and so others. I really enjoy to see all that interview. And now I lost the interest. I'm sleeping and eating pizza and Coca-Cola and Brigadeiro and high-calorie foods, and I really don't like to do anything more. This is the criteria for a depressive episode. Okay, there is some classifications that can possibly establish this, because you can come to me and say, Mario, Juruena, do you really enjoy to see any football game from Inter, our team that we support? And I could say to you, yes, I like to see. We almost won the Brazilian championship, and so I was so sad about what happened in the Brazilian championship of football. Our team lost this. I was sad, but I didn't lose the interest in to do that. It's different, a kind of sadness with something that is mild. But anyway, I think I give a big picture about the main criteria for depression. Anxiety is the same. You have different subtypes of anxiety. You can be very anxious with something that can happen. So we call generalized anxiety disorder. So I'm worried about what's going to happen in September in UK with the feeling of the fall of, and the people will lose 80% of their salary. The economy will go down. This is possibly impacting mental health of several people. A patient of mine have a panic attack. This is a very highest level of anxiety. He always difficult in breathing. The heartbeat is always beating so fast, and then he need to go to emergency department and say, I'm feeling I'm gonna die. And then they measure the blood pressure is high because he's anxious, but they do a ECG. So your heart is fine, no worries about that. You have different subtypes of depression. You can have the opposite. Like I said, you can have anorexia, not like to eat anything, and do not sleep, have insomnia. You have different subtypes of anxiety, like a mild anxiety or very high, like panic attack. You have one of that is not really more in the group of anxiety. It used to be in the American classification for American Psychiatry Association in a previous edition. Now you're in the 5th edition, 2013, but in the 4th edition they call post-traumatic stress disorder as part of the anxiety group. You know, somebody that suffered a terrorist attack or was in an earthquake situation, or even in Brazil in a car accident. This guy can suffer from a post-traumatic stress disorder related to this stressful situation, you know. So these patients usually could not sleep. Oh, you can say veteran of wars had a traumatic experience, and that they still having dreams about the situation. They have traumatic experience to see their colleagues dying in the front of. This can happen in other stressful events. You have psychosis as well, and so psychosis is more severe when you have alteration of the sense of perception. You can hear something that is not happening. You can see something that is hallucination, auditory hallucination, visual hallucination. And then you have drug abuse. This is another big problem in our societies, you know. So even drugs that you can consider that are not so strong, like marijuana, that have impacts in memory and evolution, or very severe drugs like cocaine, crack, heroin. You have big problems in UK with heroin. And now we have these club drugs like LSD, psilocybin, and others. And so you have problems with drugs that can impact in all these mental disorders and can even impair them. And this will be a big challenge for the next term, you know.
You know, I in a sport life, I learned in a hard way the stress situation affecting my athletes in the sport, because you can have a stress on physical stress or mental stress or even external stress, and the reactions and the consequences are almost the same, and sometimes even hard for you to identify why he is so stressed right now, because there's no reason, because sometimes even he create his own stress without no reason, and then it's hard for us, for a regular person, to identify, to treat, and then as a global person, how we deal on that, especially because people who change countries, sometimes an athlete go to a competition, sometimes a worker go to a company, sometimes a student goes to college, how to deal with that.
Yeah, definitely. New situations is part of life, you know. A novel experience can really activate this axis, that is the stress axis that I mentioned before. But if you don't have the vulnerability, usually you can cope with these new situations, you know. I remember when I was 15 and I moved to Florida to live some months with American family, I was really afraid, you know. I'm gonna go to spend my next months with somebody that I don't know, and I don't know how to speak in English with them. What do you think about me? And so it was really a very anxiety possibility when I was younger. But you know, when you have already this experience, when I moved to Sao Paulo 10 years later, was not so difficult for me to live alone there. You know, it's my own country. This is something that attenuate my stressful situation. But if you suffer from some very early stress, like you call early life stress in childhood, if you suffer from abuse or neglect from your family members or for somebody that you really trust, this is really impacting in the adult mental health, you know. So this is something that you should assess, you know. When I was a younger medical doctor, my professor used to say to me, Mario, it's really important that when you are assessing a very severe patient, you can ask them about suicide, or if they believe this life not worth living. because you should know about that, and they need to talk about this situation. And now I try to teach my younger colleagues in the training that they should ask it about uh, the previous history, if the patient suffer for any kind of neglect, abuse. Emotional abuse is something that really impact in mental health. You know, if a child with 6 7 years old were compared with a sister or a cousin or a colleague, oh, you are stupid, you are uglier, you are not so intelligent like your sister or your brother, and this is make not like a bullying, but it's more than a bullying, because it's usually the family member, the care. This is to increase the sensitivity of stressful events when the guy become a teenager, or even an adult. You know, increase the vulnerability for severe mental disorders as well. So stress is everything. You know,
Yeah.
if you can cope with stressful events, this is what something that I was talking with Eloise. I think we that were trained before, we managed to cope with these stressful events, you know, and try to do that. Very long trainings with so many meters was not easy at that time, you know. I keep in my mind some of them.
This week, you are set to participate in a Royal College of Psychiatrists in an event called the Treating Mental Health Disorders in a Changing World. And your presentation is setting up for treatment-resistant depression. Can you just describe us, Zach, what's going to come up on this?
Yeah, so the Royal College of Psychiatry is the association that is really important in the world, because I think it's one of the first association for psychiatrists in the world. And they have a continuous programs of educational, you know. They try to update the colleagues uh, about the different topics. And this is my topic, you know. As I said, we have this service now that we started some years ago to provide supervision and recommendation for secondary care colleagues about patients that are resistant to usual treatment for depression. So you try to discuss the case with colleagues, you try to provide a second opinion, and you try to follow the patients as well, and assess these patients if they are not responding to the current treatments. And so my talk in this meeting, that usually you have these meetings very often. We have one meeting that is the International Congress of the College. It is once a year that I will talk now. It's a pity, Pussy, because last year was in Edinburgh. Edinburgh, Scotland, is quite close to Sweden. Maybe I can visit Eloisa and family there. But they canceled the meeting in Edinburgh last year, and this year again, they supposed to be in Edinburgh, but they cancel again, and it will be online. So I will be speaking about this topic, treatment-resistant depression, how you can help to identify this patient. That sometimes it's difficult to identify who are not responding to current treatment and to usual treatment, and how you can propose better treatment for them to reach full functional recovery of depressive episode. I'll be talking about these patients that have this vulnerability. So it's a genetic vulnerability, and also a correlation with the environmental vulnerability. And somebody that suffers from psychosocial stressful events possibly can have a higher risk to develop this treatment-resistant depressive episode. That always combine with other comorbidities, anxiety, as I mentioned, childhood trauma, and also in several cases, alcohol and substance abuse.
You remember, as much as we talk here, we have all kind of different public watching, and we cannot hold our back and refuse. We dealing with something else. It's way more closer than we think. So depression, anxiety, and stress, it's part of our life, it's part of our family. But what you can tell us, what we can do on trying to prevent, minimize, to address what we really, as a regular people, talking to a person who knows how to deal with that and how we can minimize all these effects.
No, I think the main point, this is a good question, Pussy, to minimize these, you should identify these as early as possible. The problem is that most of these disorders, uh, the medical doctors, the psychologists, takes years to identify. And so this is a problem. So if you have a possibility in schools, in sports, uh, coaches, teachers, or even family members to identify some of these symptoms. And also, as I mentioned, Royal College, Brazilian Psychiatry Association, American Psychiatry Association, they have leaflets for lay people. And these are really well defined. So the main criteria of the symptoms are try to make it as simple as possible. So if you can identify these symptoms, that this teenager, depression usually start between the 20s and 30s, is usually in university school uh, students that usually start to have these symptoms. But some other problems with drug abuse start in teenagers, alcohol abuse, anxiety symptoms, bipolar disorder is another one that is really impacting in the society today. Is patients that oscillated from depressive symptoms to euphoric symptoms. And this is not difficult for family members to identify. So answering your question, I think you should identify this as early as possible, because when they have already some years, it will be much more difficult to reverse and to improve these symptoms. And so the early diagnosis is the best, to prevent is the best.
Fantastic. As a person who has over 100 original research articles, 4 books and reviews, plus awards, what's coming up on Dr. Mario Juruena future? What's the next goal? What's the next project? What's coming up? And I know you probably realize yourself, because you make people's life better. And definitely, I don't want to answer the question to you, but I want to know what's coming up on the Dr. Mario Juruena future.
It's just there's 5 books. I just published the last one with that is will be available now, is about bipolar disorder, from neuroscience to treatment. This is something that changed. Bipolar disorder was a disorder that, as I mentioned, oscillating like a roller coaster, mood and affective. In the 90s, you think that was just 1%. Now you know that is more than 5% of the general population with this diagnosis. So it increased with the last data, last evidence, in 5 times. This is really impacting, in our society. But I think you mentioned the most important thing, that I still receiving feedbacks, especially now in these networks, from patients that I treated when I was a young doctor in Porto Alegre. So receiving this feedback that they really miss me, and they said me their life is much better since they started the treatment. This is amazing. Now that I moved from São Paulo 5 years ago, I received several feedbacks from patients from there. This is really makes a difference, that you can help people, help families to improve the quality of their lives. And definitely psychiatry can help people to change their vulnerability for mental disorders and to improve their lives. Not all. This is a pity. You have some patients that is still chronic with some, like other disorders, like diabetes, like high blood pressure, like oncology. But you can help a lot of people that without treatment will be much worse. The next step, I'm not sure. With these difficult times, I cannot say too much about the future, but maybe I can help Eloisa to develop the global patient, and maybe can help you to find other colleagues that are spread across the world, and possibly help you to return to our 5 groups in the WhatsApp that usually miss you, Pussy. And I'm not sure. I like to come back to Brazil more often, this was something that I miss because I usually was invited for 4 or 5 Congress in Brazil in 2019. This was good to visit our country and to see my family and friends. And last year, I went to Brazil, I think 20 times, but just online. And this is a pity not to see the people that we love and miss so much.
You know what? Unfortunately, my prediction is I don't think we're gonna go much in person. Not just about the pandemic, but I think we are just moving on in another era. I could be wrong, but definitely the impact of the in-person is definitely different, and then that's what we learn, and that's what probably the next generation will not feel what we're suffering right now. Dr. Mario Juruena, you have no idea how much you impact not just me, but several people were watching and learning from you. And then keep going, keep teaching, and keep developing this, making people's lives better. I appreciate it. Was so good to have you here with us today.
Thank you so much for these opportunities. It was my pleasure. Thank you.